Hi, my name is Channing. I'm a PT at our Plainville PTSMC, and today we'll go over a self-hip mobilization that we use for people that have pain with squatting, particularly groin pain or pain deep in their hip. If you have left hip pain with squatting, you would start on all fours. We're going to have the affected side or that left side centered underneath your body. We're going to have your shin bone rotated just a little bit underneath you, and then from this position, going to gently oscillate down into the table. What we're looking for here essentially is the pressure from your femur pressing into your backside. So you should feel a deep stretch, not really a muscular stretch, more so a deep pressure as we loosen your joint capsule itself. Holding that position statically for 30 seconds or oscillating gently into the table. This is an exercise progression that you can use if you have lateral hip pain. We use this for our high-level athletes that have outside hip pain or even knee pain with running, as well as our older adults that have hip osteoarthritis. So the exercise we're covering is a lateral walk. There's a few different variations you can do. Our easiest version is starting with the resistance just above your knees. Having your feet about shoulder width, you're going to take small choppy steps side to side. And what you should feel is a pretty deep burn in the outside of your hips. Now, if that is too easy, as opposed to adding more weight to this, all you need to do is lower the band. If you have it around your ankles, it's going to make your hips work a little bit harder. Technique remains the same. You're still going to have your feet about shoulder width, small choppy steps, keeping your toes pointed forward the whole time. Now, if that version is too easy, our hardest variation would have the band around your toes. Now, I like this version because if the band is around your toes, it's trying to internally rotate your hip, which gives you more of a challenge with this exercise. Now, a lot of people feel like they have tight hip flexors, so we're going to go over to the test to see if you need to stretch your hip flexors, and then if you do have tight hips, how do you perform a proper hip flexor stretch? But today we're going to go over the test to determine if you truly have hip flexor tightness. We're going to have patient Kevin take a seat on the table. He's going to gently roll back, hugging both of his knees, and then slowly lowering down his right hip. And what we're looking for is where his thigh ends up on the table. A negative test would be having the back of his thigh touch the table. But as you can see here, the back of his thigh is not quite touching, indicating he does have hip flexor tightness. So the biggest issue we see with hip flexor stretching is that people want to take a really big lunge position to feel a stretch in the front of their hip. While this might seem advantageous, what we actually want to see is a more narrow base of support, and I want to see a posterior rotation of your hips and then a small lean forward. If you have that posterior rotation, you should actually get a bigger muscular stretch in the front part of your hip.